Egg freezing has become a lot more popular, especially in the last 30 years. We've seen a large increase, approximately 75% increase in the numbers of women freezing eggs. And I think that's largely attributable to increased awareness in the population about this option, and also the fact that some insurance companies are starting to cover the process. The benefit of egg freezing is that it stops the biological clock, which is pretty amazing. So as women, as we get older, the quality of our eggs declines and the number of eggs we have declines. But if you can freeze the eggs, you can stop the biological clock, so to speak, because they're frozen in time. As women get older, the chances of pregnancy decline, and that's mainly attributable to the age of the egg. And as women get older, the eggs can become less healthy, and therefore the pregnancy rates decrease as women get older. But if women freeze eggs, they stop the biological clock, and if they come back to use those eggs when they're older, their chances of success are the same as they would have been if they got pregnant at the time that they froze the eggs. The best time to freeze eggs is really at age 35 or less, although we have frozen eggs in some patients that are older than 35. We can do it for the right candidate, but the chances of conceiving are much higher if women freeze eggs when they're younger, and that's the time that women have the most eggs and the eggs are the healthiest. It's important to realize that women lose eggs every month, and the egg freezing process does not accelerate the loss of eggs for a woman. It actually helps rescue the eggs that would otherwise be lost that month. The success rates with frozen eggs are excellent. They are similar to our fresh success rates with our fresh IVF cycles. The process of egg freezing is actually surprisingly easy. It requires about 8 to 12 days of medication, followed by a procedure called an egg retrieval. And this procedure takes about 20 minutes or so, and patients are very comfortable during the procedure and they don't feel any pain, and they go home the same day. It's a very quick process. If women are thinking about freezing eggs or would just like to obtain more information, they can visit our website, or they can make an appointment to come in and meet with one of the providers and have an evaluation. And this can consist of blood work and an ultrasound and some recommendations by the provider. We also from time to time run some promotional events where we offer free testing of AMH, which is a blood test to check egg supply. The Fertility Wellness Visit is an excellent opportunity for individuals to obtain more information about their own fertility potential and learn, for example, a little bit about their own egg supply and how that compares to other people their age. And this information can often be helpful for the individual in terms of planning for the future, especially if that person is considering egg freezing. The Fertility Wellness Visit includes a free blood test, and also the patient fills out a questionnaire to give the provider some information about her general health, medical history, and the provider then reviews that questionnaire in combination with the blood test results, and then can counsel the patient about where she stands in terms of her own fertility potential, and we can also make some recommendations at that time. To sign up for the Fertility Wellness Visit, you can check out our website, uconfertility.com, and we also have postings on social media as well. So please do look out for these opportunities.